This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Over the last year, we've increasingly heard from members that they're starting to think about prioritizing their ambulatory footprint in an equal fashion to their acute footprint, which is certainly a change of pace. It used to be that the acute care setting was top priority where most of the resources and attention were focused, but we're increasingly seeing a shift to that outpatient space.
Welcome to Sg2 Perspectives. I'm your host, Trevor DaRin, but I'm with the slate of hosts, Bill Woodson, Tori Richie, and Jayme Zage. We're going to take a look back at the 10 things everyone was talking about in 2024. We got together and put our list together, and I'll kick it around to jump in round robin. Bill, I'll start with you. AI had to be near the top of this list of things people were talking about all the time across a bunch of different settings and applications. What did you hear?
That's ironic. The year started with a JP Morgan conference, and that was the number one topic there. And I would say momentum has continued throughout the year with ups and downs. Our colleague Andrew says, don't stop believing. It keeps moving forward. We're still in this world of digital Darwinism, meaning companies are coming, companies are going. But most of our members as health systems have moved on from deliberation and testing into integration of certain aspects of AI. Andrew said last year that it'll start to seem normal that technology is part of the care team. That's already starting to happen. And Trevor, you and I were in a meeting earlier this year where we were asking the doctors about ambient listening technology. And I would say in the first part of the year, there was cautious optimism. And now I'm hearing out full-on enthusiasm despite its imperfections. It's amazing. So the New England Journal actually has a spin-off publication devoted to AI right now. And we're seeing the beginning of some pretty profound changes in recognizing symptoms of disease, preventing readmissions. We're getting into the clinical use cases that we're just scratching the surface on last year. And if you think about the different areas that our members are deploying AI on, it's infrastructure, efficiency, and innovation in what is the work, how are we going to redesign it. Whether it's digital focused or AI or a combination of the two, the Achilles heel of our part of the healthcare industry is cybersecurity, and we're going to hear more headlines about that one in 2025.
Yeah, that's a great one. Thanks for kicking us off with that. I'm going to take the second one, which is around the economic impacts. This one shifted a bit throughout the year. At the beginning of the year, there was a bigger spread between those who knew they were in growth markets, had already planned new builds, new growth, had more priorities on the table, and had positive margins from the year before, not 8 or 9% where they used to be, but 4 or 5%. And those who were still struggling, just barely positive, moving into the black. By the end of the year, I don't think it normalized where they came back to the center, but those who were struggling in many cases had at least seen some incremental progress, probably not yet to sustainability, but progress where now there's more growth initiatives on the table. They're exploring more opportunities. The episode I did a couple weeks ago with HGA Architects, I really like the way they outlined it. Systems have been balancing the need for efficiency in any new build with the need for future flexibility because of uncertainty around aging population, technology, et cetera, and wait to see how those scales tip to give them a sense of how systems are investing and thinking either short-term or long-term. I like that distinction. All right, Tori, I'm going to come to you next. A topic near and dear to both of us, harnessing growth and capacity. What have you heard how the message changed throughout the year?
The key message is just channel your inner Trader Joe's. We've seen year over year growth in inpatient and ED utilization across most organizations. That's left us really questioning, is all volume growth good? And when we think about some of those drivers, folks are presenting to the ED because there isn't that ambulatory access that they require. It's because of rising incidence of chronic diseases. It's because of the aging population. If we're really measuring what does success mean, we need to think more holistically about how we are defining those growth measures. It goes beyond just those volume counts alone, but also thinking about, have you deployed the right clinical care team to be managing patients' conditions? Are you investing in the right sites of care in order to manage their conditions upstream to make then your higher acuity sites much more efficient? Because the reality is we've got the workforce that we've got, and seeing 5+ percentage point growth in ED and inpatient year over year just simply isn't sustainable.
Well said, and I've seen systems move there, but it hasn't been a sea change. It's been slow and steady progress. Another evergreen topic, Jayme, has been partnerships. They've taken a little bit of a different flavor this year.
Absolutely. And the partnerships really reflect what's going on with some of those economic realities that you talked about, with some of those growth realities that Tori talked about. And it's how do you create your ecosystem for your health system so that you can make sure that all the care that needs to go to patients gets to patients. It's things like partnering with your competitors or partnering with others in the market. And that's been tried and true for a while. University of Chicago working with Advent Health, for instance. That's not an unusual type of partnership. But now you're starting to see other types of partnerships where now we've got academic centers who are partnering together. So University of Vanderbilt and Penn Medicine, for instance, around their genetics program and the counseling and the education. It's not an all-out partnership there, but it does get to how do we work together across systems to more effectively leverage those constrained resources that we have to still meet the needs of patients in the community. On the really non-traditional side is when we start to partner now, providers partnering with non-providers. So big data or business ventures. Ohio State has partnered with Helix on precision health and looking at wellness and prevention and early intervention. That's an innovative partnership that was shared at our AMC summit earlier in late 2024. We also saw at our executive summit, we had some organizations that shared their partnership experience. So Gore and Froedtert Health talked about how they work together. Froedtert Health has a supplier forum where they've got a number of suppliers they work with, but Gore being one of those, how they work together to accelerate how purchasing gets implemented, gets executed within that partnership model. The other was Compass One and University of Kentucky, where they talked about the importance of bringing food security to certain patients to make sure that the health of the patients is manifested in that nutritional component as well. There's all kinds of different partnerships where we see non-traditionals leaning in to help with that efficiency or to help with quality improvement. There's a growing list of those non-traditional or sort of unconventional partnerships to help solve some of the problems that we're dealing with in healthcare.
Jayme, I'm going to stay in your realm, life sciences and industry partners, for the next one, which is pretty dramatic changes in cell gene therapy, new cancer treatments, and other pharma innovations.
Absolutely. And we were just talking about this recently. Cell and gene therapy was something 5 years ago we said was on the horizon. It's still investigational. Well, it's here now. And we see it as FDA approved therapies for patients. Now, they impact the economics again. Some of these are incredibly expensive, but they actually do change the course of the disease. They cure the disease in some cases. Now, the pipeline for that is a lot more coming down that are maybe going to not be quite so curative, but they're going to have significant impacts. They're going to be more repetitive, maybe not quite as expensive. So there's an evolution going on here in cell and gene therapy. The other biologics that are coming through, the infusion therapies, we're seeing a lot of innovation. Bill, I think you coined it really well at the executive summit and in other places and talks that you've done, is that medicine is the new medicine. And we're seeing more and more innovation in medical intervention. And that medical intervention is now going to start to have an impact even on surgical intervention. And we see that with the GLP-1s and the obesity treatment, the diabetes treatment, cardiovascular treatment. But as an obesity treatment, the GLP-1s are already having an impact on obesity or bariatric surgery programs. We're seeing that across the board. Every organization I talked to this year mentioned, yes, our bariatric surgeries are flat or declining. Bill, if you had any other interventions that you've heard about that you want to bring into the conversation?
It's just a broader recognition of the topic of pharmacy as essential to the enterprise, how much profitability comes from it. What's our strategy for specialty pharmacy moving forward? Who will our partners be? For some of these drugs, are we going to be working with a supplier directly who will compound them? And we're going to negotiate directly for these very expensive drugs. And then it comes up in the Medicaid conversation pretty quickly because some of these therapies are for kids. It's moving quickly. It's dynamic. And Jayme, if I could connect it back to the AI conversation, the breakthroughs that are happening not only with clinical trial drug discovery, but also clinical trial recruitment are really powerful right now. We don't work directly in that space, but I know it's affecting some of the organizations that you partner with.
Yeah, and even clinical trial management and being able to get to those endpoints quicker with real-time evaluation of the data as it comes in.
Tori, I'm going to jump to you, pivoting to kind of a different segment of the industry, thinking about payer trends. I want to acknowledge really troubling news about the United Healthcare CEO. Independent of that, what did we hear this year from payers?
Aside from the troubling news regards to United Healthcare, what else we've seen this year in payer trends, we've completed Medicaid redeterminations following the expiration of the public health emergency, where over 25 million individuals lost coverage through Medicaid. Where these individuals then fall across our other financial groups is something we're actively tracking. The reality is, with mounting pressure for employers to offer some sort of coverage to employees and their families, we don't expect uninsured rates to grow dramatically because of these redeterminations. In addition, through the Inflation Reduction Act, expanded subsidies are available to individuals in the insurance marketplace. There are also navigators that have been put in place to help people who have come off of Medicaid, helping them transition to a commercial plan through the insurance marketplace. So we're expecting robust growth in that particular area for this year in the 2025 enrollment season. We also expect that there is some amount of individuals that'll just simply be on a commercial plan through their employer as they lost coverage through Medicaid. What we're really watching now, though, is what are the implications of the incoming Trump administration? What are some of the likely downstream effects on coverage that are expected there? We expect there to be budget cuts to Medicaid programs, which will drive attrition over the coming 4-year term. We think that it's reasonable to assume that funding cuts will occur to the insurance marketplace, particularly with those subsidies, which are slated to expire at the end of 2025. So likely to see some attrition there, which could then contribute to a pretty substantial rise in that uninsured population. So all things to keep track of, but really underscores the importance of providers working closely with their patients to ensure continuity of their care as well as continuity of their coverage.
Tori, you know what? Let's just do a whole episode where we talk about our insurance coverage forecast.
I think that sounds like a good plan, especially since it's slated to be released on December 11th.
I know the person to talk to about that. Bill, I'm going to come back to you. Another topic everyone was talking about this year, but with a pretty different tone, was the disruptor landscape and how much they were disrupted this year.
It's a topic we followed for a number of years, and the headline grabbers, CVS, Aetna, Walmart, maybe about their struggles with healthcare, withdrawing from the business, reconfiguring their business, tied to probably a whole bunch of factors: operational complexity, workforce, just basic economics. We shouldn't overlook the fact that the consumer friction points that they tried to address are still out there in the marketplace. Someone else will find models to help meet those needs. Walmart in some of their markets isn't completely abandoning their business. What they're trying to do is find health system partners to come in and run it for them. They probably have a better idea how to do that than a retail chain. Walmart's earnings overall look very strong, not so much for Target. But we'll continue to watch, Trevor. It shows up in our claim stream. We're watching Amazon. We're watching the other tech providers. Of course, we'll watch the big payers and where they're going to make their bets in certain aspects on the front end of the system of care, and more importantly, also on the back end with home care. Private equity is still out there, probably with some scrutiny coming to it in the new year, but the deal flow continues. And so we'll watch it. Disruptors are out there, just not the headline leading ones that we've come used to seeing the last few years.
Yeah, it was interesting to see for 2023, I think maybe into 2024, that it was the private equity and venture capitalists who employed more physician practices than any other. So even more than hospitals and more than independents. They're still strong, but they're still letting the physicians manage themselves to a certain degree. That's where you've also got those big components. And that's where like United Healthcare coming in is one of the biggest employers, obviously, of physician practices.
The biggest. Tori and Bill, two concepts coming to you guys next that are emerging as themes that I'm hearing more and more from systems, although they're still grappling with what it means and how they make it practical and put it into action. Tori, you first. This idea of ambulatory-first, how is that becoming a concept and a principle that's helping systems prioritize and think about growth differently?
Over the last year, we've increasingly heard from members that they're starting to think about prioritizing their ambulatory footprint in an equal fashion to their acute footprint, which is certainly a change of pace. You know, it used to be that acute care setting was top priority where most of the resources and attention were focused, but we're starting to see that landscape shift in large part due to payer pressures, reimbursement challenges, consumer preferences, and even some of the disruption that we just mentioned. We're increasingly seeing a shift to that outpatient space. nonprofit, but also for-profit systems alike are thinking through how to expand those ambulatory services. It's thinking about how do we start to shift these care pathways to those lower acuity care settings, making sure that we're building out access points in a manner that's convenient for patients and a manner in which we're able to improve some of the efficiencies within our individual systems and frankly be able to capitalize on those growth initiatives that we're setting out for ourselves.
Bill, the other concept, very fluid, starting to crystallize around systemness. How have you heard systems change the way they talk about, think about, and prioritize as systemness becomes more real for them?
There's a variation. I listen for it. I ask about it in each meeting that I attend. In some systems, it actually is a conversation about ambulatory-first. How do we as a system think about strategy and operationalize our vision for ambulatory services cohesively? In other systems, it's more rudimentary, meaning all these pieces have been put together pre-COVID, post-COVID, and the system itself has never really taken a hard look about what should be centralized, decentralized, what are the guardrails for the decisions we make, what's local, what's not, and that hard work is starting to get done. In other organizations, it's a clinical message. It's something about our clinical variation. We heard Dr. Levine talk about that at our summit this summer. In one system, an academic system we work with, their system, this message is around safe and reliable. So they want to be the safest system in their state. They stated that explicitly to all their employees, and that's going to be their rallying cry. To me, it just gets down to it's the scaffolding of how we're going to put these larger organizations together to make them relevant over the course of whatever the next strategic planning cycle is, which is something I know that you work on. And more discreetly, what are they working on? Well, it's network integrity. How do we keep the patients in our network? How do we optimize our service lines across the geographies that we serve? Maybe it's more of a system of care discussion, ambulatory and then post-acute. And then it could be more about the patient journey itself. So there's other approaches to systemness that are very much focused on care coordination and the handoffs. And the top of mind topic for all of our members right now is access to specialists to take that on as a system function.
It's interesting. This has been an area of research for the Vizient Research Institute as well as the systemness and decision-making. When the decision-making is centralized versus decentralized, how that impacts quality operations and those types of things from a performance perspective. And that report will be coming out in early 2025. Definitely look for some insights into that as organizations continue to work on their systemness piece.
I'm glad you brought up those words because I'm waiting to see if it becomes a centralizing or decentralizing force around planning and strategy and priority and goal setting. Here's number 10. Systems have kept a pretty small set of priorities, and that's been a conscious initiative for them to, one, say no to some things, two, be thoughtful about how they manage their list of priorities and potentially take things off the list if they're going to add something new. There's a huge set of possible growth options, especially through partnerships that are on the table, but systems are getting really rigorous in how they evaluate those. I heard one CSO say, we learned how to not go to the grocery store hungry around this stuff. And I thought that was really sharp and illuminating that they're still taking just as many meetings, but being selective in who they get serious about pilot with and move forward with. Bill, Tori, Jayme, thanks so much. That's 10 things that we heard everyone talking about in 2024. Thanks so much to all our listeners and have a safe and happy new year. Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, Sg2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.